Good morning, good afternoon, and good evening. Welcome to our launch today of the Assessing Unconventional Evidence tool. My name is Nandita Tate. I am a technical officer at WHO in the Department of Sexual and Reproductive Health and Research, where I lead the IBP Network, a consortium of civil society organizations working in sexual and reproductive health and rights. We are delighted to be co-hosting this event with our colleagues because we at the IBP Network really believe in the power of storytelling, lived experience, and different kinds of evidence to inform our work. And so we are delighted to learn about the development of this tool and understand how we can better use this tool to, to make sure that storytelling, lived experiences all contribute to the wider evidence base. We have a very exciting agenda for you today. Just a quick word on logistics. The session today will be facilitated in English, but we do have interpretation into French and Spanish. So please do select the globe at the bottom of your screen if you would like interpretation. We have kept the chat open to foster dialogue, so please do introduce yourself in the chat. Feel free to submit questions in the chat as well. We also encourage you to submit your questions using the Q&A box, also at the bottom of your screen, and we will have some time for question and answer at the end of the session. Finally, the session will be recorded and posted to the www.srhr.org website. So with that, I'm going to turn it over to my colleague, Dr. Etienne Langlois, to walk us through the agenda and walk us through the rest of the session. Etienne? You have the floor.
Thank you very much. Thank you, Nandita. Very warm welcome to everyone. I'm delighted to be here. I'm Etienne Langlois, a team lead for knowledge at the Partnership for Maternal, Newborn, and Child Health at WHO. Joined today with a stellar panel grappling with those issues of bringing contextualized knowledge into policy and implementation. So it's a really exciting time. We're launching today the ACE tool, which stands for Assessing Unconventional Evidence tool. And this really follows a movement of using a wide area of evidence and knowledge to support policy and practice. So increasingly, we're looking into community voices, implementation, exemplar stories, case studies, policy and systems descriptions to really feed into implementation and scale up and drive a movement towards people-responsive health services and people-centered health systems. So the tool really has potential to drive implementation and impact. We're very excited to present this to you today. We felt, when we started to develop this tool that we were missing a robust approach to assessing this type of evidence. So this is really where we are coming from in terms of a public good to support the assessment of the strengths and limitations of this type of evidence that we call unconventional. So this is what we are going to look into with the panel. We will talk about the content of the tool itself, and we will then look at the use of the ACE tool in different contexts. One is for WHO norms and standards, and the other one is for local health systems decisions. Really happy to have speakers from Trinidad and Tobago and Ethiopia today. We will have time for a Q&A, so please think about your questions, your insights for impact in real-world settings. So we look forward to hearing from you. Without further ado, I'll then hand over to my colleague, Annie Portela.
Thanks so much, Etienne. Welcome, greetings to everyone. Thank you for joining us. My name is Annie Portela. I work in WHO in the Department of Maternal, Newborn, Child, and Adolescent Health and Aging. And I just wanted to start the story and tell you a little bit about the ACE tool from a WHO perspective. So as you know, we in WHO are committed to strengthening our processes for evidence and global guidance, be that in strengthening the evidence base or the research that feeds into that evidence base. And some years back, as we were working on global guidance for health system and health promotion interventions, we realized we needed to expand the scope of what is looked at in evidence-based decision-making, including the study designs for certain types of interventions or evaluation of these interventions. Too many reviews were coming out saying no evidence was available. And we also learned that in order to evaluate certain interventions, we really needed a more in-depth understanding of the context and of implementation. And this type of information is often very hard to find in journal articles. So to address this and the growing need for implementation research to bring evidence-based interventions into practice, WHO developed the program reporting standards to support implementation research, program implementation documentation, and tried to ensure standardized documentation from different programs. And we'll put that link in the chat in just a moment. But now the problem remained. We had these program reporting standards and it was good for information sharing, but how could this be used in decision-making process? And here comes now the story from our collaboration with Simon Lewin. Simon will take you through some more of the details of the ACE tool and how it fits into that picture. So Simon is a professor of health management and health systems at the Norwegian University of Science and Technology, and also a senior researcher at the Norwegian Institute of Public Health and the South African Medical Research Council. He's got a keen interest in how research evidence can be used to strengthen health systems and coordinates the Cochrane People, Health Systems, and Public Health thematic group. So over to you, Simon.
Thanks so much, Annie, and thanks to everyone who's involved in organizing this seminar. I'm really looking forward to the discussion. Next slide, please. Etienne and Annie already talked about the importance that many different stakeholders place in policy and program implementation descriptions and other kinds of local evidence, as well as professional or sometimes called tacit knowledge. These are types of evidence or information that many decision makers are very interested in and program implementers. Next. There are, of course, rich sources of information on the feasibility and acceptability of interventions, as well as helping us understand what factors might affect implementation of programs or interventions. And they can be very useful in the development of decision support products, including evidence syntheses, health systems guidance and clinical guidelines, and evidence briefs for policy making, both at the national and the global levels. Next. But as Annie's already outlined, to use these unconventional sources in evidence syntheses or other decision support products, we do need a way of assessing the strengths and limitations of the sources that we're dealing with. Next slide. Before I go on to talk a little bit about how we developed the ACE tool, I wanted to say a bit more about what we mean by unconventional source materials. And in fact, even the term was quite a challenge to come up with a term to describe this group of sources. But they do encompass a wide range of different types of information that largely share a set of characteristics or features. Next. These are sources that are generally descriptive rather than analytic in nature. Next. They're often based on people's views, experiences, or observations, or may include data from routine sources, health management information systems, or other kinds of information systems. And they rarely include empirical data collected using explicit methods, as would be the case in planned research studies. So this is not a tool that's focused on qualitative research, primary studies, or other kinds of observational studies with explicit methods, but on these other types of descriptive materials based on people's views and experiences and so on. Next. Next. So we developed the ACE tool to assess the strengths and limitations of these unconventional source materials. And the idea is that the tool will provide users such as yourselves with a structured and transparent assessment of the limitations of these sources. And as Annie already mentioned, this is work that was developed with WHO, but also had input from a very wide range of potential users. Some of you on the webinar today may have participated in some of the testing of the tool earlier on. Next slide. So how did we go about developing it? In the first phase or stage, we looked at what tools were out there in the literature. There are some existing tools that are intended to help critically appraise grey literature and some other related tools, but we felt that these were a bit too narrow for our purpose. And specifically, we wanted to develop a tool that would be useful for people, both in day-to-day program implementation, development and implementation, but also in developing evidence support products. So we decided to use some of these existing tools as sources, but to move on to develop a new tool. Next. We created a first version through workshopping, which included 11 assessment criteria and some instructions for users to apply the tool. And then in stage 3, went on to do some user testing of the tool. Next, please. And this is when we piloted it both in a couple of evidence syntheses, but also in several meetings with users and experts to get feedback. Next, and in the final stage, we refined the tool, and the version that you see today in the paper is based on that and also includes 11 assessment criteria. Next slide. These assessment criteria focus on 3 core elements: the purpose and context of the source that we're dealing with, the completeness of the information that's presented in the source, and the extent to which evidence is provided to support any findings or conclusions or issues that are drawn out in the source. Next. On the basis of the judgments for each of these 11 criteria, the users of the tool then make an overall assessment of the limitations of the source. And this may range from no or very minor concerns to very serious concerns regarding these limitations. Next slide. I'm not going to run through all the criteria now. I hope many of you will have already or looked at the website and the paper, but you find much more detail on that there. Next slide. What I did want to talk a little bit about is how the ACE tool contributes to the evidence ecosystem. And I'm sure the speakers to follow will also be talking to parts of this. And I think many of you may be familiar with this evidence ecosystem cycle. It starts with producing evidence through primary data gathering, sometimes synthesizing that evidence into reviews, which may in turn support decisions, support products like guidelines and evidence briefs. We have dissemination to stakeholders, implementation, and then evaluation, generating more primary evidence. And we've indicated in the sort of red and pinkish blobs where we think the ACE tool might support. And as you can see, we believe it can be useful at almost all the stages of the evidence ecosystem cycle. So for example, unconventional sources can be used in a systematic review that might, for instance, be looking at factors affecting the implementation of an intervention from the perspective of stakeholders. We could also use the ACE tool in the evaluation and improvement of policy stage, where it might contribute to helping structure the kind of program reports that Annie was referring to briefly earlier. Next slide. I wanted to specifically talk about the use of the ACE tool to support the inclusion of unconventional sources in guideline development and in national adaptation processes. Guideline development is a key element of the work that the WHO does, and WHO guidelines are heavily used in many settings. And many of you will be aware that WHO uses a structured evidence to decision framework to develop those guidelines. And in this framework, which is not rocket science, it's just a way of organizing information. The panels developing guidelines will look at evidence that's been organized into different boxes or criteria, including what are the benefits and harms of the intervention, how do people value different outcomes related to the intervention, and to what extent is it considered to be acceptable and feasible. Next. And we believe that the ACE tool can help to introduce and use local evidence and other unconventional sources in several aspects of guideline decision-making, including the acceptability and feasibility of interventions, equity impacts, and also importantly, feeding that information through into implementation considerations. Next. So why should you use the ACE tool? Next. As I've mentioned, we believe it will support the greater use of unconventional sources in decision support products for health and policy and systems decision-making. Next. It can also help feed into assessments of how much confidence to place in findings from evidence syntheses that draw on unconventional sources, and we have a couple of examples of that already. ACE can also support the wider use in implementation planning of information on the views and experiences of people implementing or affected by a program. And it can also support the inclusion of community voices and real-world experiences in people-centered decision-making. And I think that part is really critical to why we developed the ACE tool as a mechanism to help us expand and build on the extent to which these voices feed into decision-making processes. Next slide. So I'd encourage you all to have a look at the paper where we talk in more detail about each of these stakeholder groups on the slide now and how the ACE tool might be useful to them. If you're a program manager, for example, or someone who's involved in evidence synthesis, the paper says a little bit more about how we envisage the ACE tool being used. Next slide. So to finish off, decision makers, of course, have a wide range of information needs when making decisions. And at least from my experience, are very keen to draw on local information and documented experiences from settings similar to their own when making these decisions. And we hope that the ACE tool will provide explicit criteria to help decision makers and those who support them assess the strengths and limitations of unconventional source materials, and through that to help use these source materials in more appropriate and informed ways. Next. We hope also that ACE will draw attention to the value of unconventional sources for decision making. They're often neglected, perhaps because people don't quite know how to manage them. And next again, help to ensure, as I mentioned, that decision making is more responsive to the views and experiences of stakeholders. Next slide, please. So I look forward to your questions and comments, and through this QR code, you can link to the paper. Back to you.
Thank you so much, Simon. That was a great overview. And I think I will start by saying who I am first, and hello to all the colleagues and the AI assistants who are on the call. My name is Özge Tunçalp. I'm with the HRP, Department of Sexual and Reproductive Health and Research at WHO, and my role is here not only to develop guidelines for maternal and perinatal health in my area of work, but also I sit at the Guideline Review Committee, which reviews all the guidelines that WHO produces. And, you know, to answer Simon's question, which he posed, why should you use ACE tool? And I think one of the key roles of WHO as the norm-setting agency within United Nations is to develop recommendations based on the latest evidence. And as Annie referred and alluded to it, sometimes it's not only about looking at the latest evidence, but looking at the latest developments of methodologies on how we can improve this process. Over the years, the guideline development process has also been kind of improving with the methodological developments. First, we started with systematic reviews and assessing the confidence by using a grade. And then, as you saw in Simon's presentation, then there's a whole body of qualitative evidence. And when we are developing recommendations and when we are looking at all of these decision factors on acceptability, feasibility, equity, we can't just stick to the quantitative evidence, but we need to look at qualitative evidence as well. That's where Great Circle approach actually helped not only WHO, but other guideline development agencies as well and country processes. So there, we were able to incorporate more confidently and more systematically and transparently qualitative evidence. But then it doesn't stop here. There's all this implementation experience evidence that is building up that doesn't lend itself as a quantitative or qualitative evidence syntheses as we would use in decision-making processes. And I think that's where the ACE tool and its value comes in when you think of WHO as an organization. My colleague Pura, who is from Quality Norms and Standards from Science Division, who we are very closely in touch with, she couldn't be here today, unfortunately, but that is something that will be really important for us to consider as WHO, and how do we utilize such a tool to be able to more sort of to encourage and systematize the incorporation of these kinds of evidence bases in decision making. And just want to close with another observation. I think when we produce these global standards, global guidelines, there is another process that happens when those guidelines are adapted at the country context. And there, the importance of implementation and evidence from different sources at the country level becomes very important and very prominent. And I see also ACE tool and how ACE tool can be used in the adaptation processes of these global guidelines or these norms and standards at the country level. So I think in response to the question that you pose, why should you use ACE tool? I think as a norm setting organization like WHO, there are multiple points where we can incorporate it in our processes, and that's something that we are working on. But I said country, and now I'm going to be heading off to floor to my colleague Etienne to actually hear from some country perspectives in terms of what would it look like and what is the use case there. Over to you, Etienne.
Yeah, thank you very much, Özge. So this next section of the webinar is very complementary to what we have just introduced. So Simon has eloquently spoken about the evidence ecosystem, and Özge has usefully presented how at WHO this tool can support a robust approach to bringing a wider array of evidence into norms and standards and guidelines. And there's definitely something to be said about using this public good, the ACE tool, to support health system strengthening, to support local decisions, move towards UHC, and then really inform implementation and scale up of effective interventions and drive progress. So right now we're going to move into the country experiences, and we're going to hear from stakeholders grappling with those issues, and we're going to hear from the utility of a tool like the ACE tool in routine decision-making and health system strengthening. So really delighted to welcome two speakers. The first one being Abi Seifu, who is an assistant professor at the School of Public Health in Addis Ababa University in Ethiopia. She specializes in implementation research with a focus on enhancing access to quality neonatal and maternal healthcare services. So delighted to welcome him. And he will be followed by Shelley Ann Hunt, who is a research fellow at the Caribbean Center for Health Systems Research and Development in Trinidad and Tobago, bringing expertise and experience on evidence-informed policymaking to strengthen health systems and advance UHC. So let us hear from Abi first. Over to you, Abi, and thanks for being with us.
Thank you so much. I hope you can hear me well. I just want to build on what Simon has beautifully presented about unconventional knowledge and the ACE tool. Looking at some of our experience in implementation research, I think oftentimes what we do is before we develop an implementation model for a certain intervention, we usually review existing literature, which often, do not capture this unconventional knowledge. And then we collect the data, qualitative and quantitative, from the field to capture the voice and perspectives of stakeholders. And then after we combine the two, we go and do a co-design workshop where we bring together different stakeholders to validate the finding we have from this exercise, as well as capture some of their voices and concerns. But I think this unconventional knowledge, if it can be appraised systematically, would be very useful in terms of filling this gap. We know the decision-making, evidence-based decision-making process follows its own pathway, but this will be a complementary, the unconventional knowledge, to that evidence base, so that we can have rich understanding of the context, which is oftentimes missed in many of the publications we have access to, or in peer-reviewed literature. And it also gives us the opportunity to know, to answer questions on the how and where. So in implementation sciences, we say an intervention has adaptable and core component. So this the unconventional knowledge particularly fits into or sheds light on the adaptable components of the intervention as complementary to what we could find about the intervention from the empirical evidence. And particularly in the implementation research realm, I think, for example, I can give you one implementation research where we spent 3 years conducting the research, and then we published, I think, around 3 or 4 papers. But there is a lot that we left behind. So I think you understand, all of who are involved in implementation research, there is a lot of learning that will not fit into any paper, but it is presented as part of different reports, documented in different communication materials we have in Zoom. So I think this AC tool would allow us to systematically evaluate this knowledge, so that the next implementation would be better informed and decision can be made in a more informed way, contextualized way. So I really appreciate the team for coming up with this tool, and we are looking forward to applying it in our context. Thank you.
Great, thank you very much, Abby. And I really like this approach of understanding context and moving towards the how and where. Thank you so much. So we're going to move now to Trinidad and Tobago, other region, but similar challenges. And we'll hear from Shelley Ann Hunt. Over to you, Shelley.
Hi, everyone. Confirming that you're hearing me well?
Yes, all well, thank you.
I'm delighted to be part of this webinar as I bring to you our experience in using local or contextualized evidence in decision making, and what we see as the added value of a new tool that can help us assess the strengths and weaknesses of conventional evidence or unconventional source materials. Next slide. So I think it's really important for me to start with some context. At the Caribbean Center for Systems Research and Development, we've been working with researchers and policymakers for the past 5.5 years to build capacity for evidence-informed policymaking, strengthening researchers and policymakers, as well as respective organizations. We've been very fortunate to work in both the health and several other social sector ministries. We've conducted evidence-informed policymaking needs assessment exercises, conducted capacity building training, and we have hosted fellows as well, policy fellows at our center. We've co-produced several evidence syntheses along with policymakers and researchers on policy priorities, including mental health, adolescent sexual and reproductive health care, strengthening our primary healthcare system, the underperformance of males in our education system, as well as what we term the dependency syndrome on the state's social welfare system. Next slide. So in our experience, we've proven the importance and the relevance of local contextualized evidence, not just in problem framing, but in identifying implementation considerations for policy and programmatic interventions. Of course, this has not been without its own challenges. We experienced challenges in finding the evidence, accessing the evidence, appraising it in terms of reliability, as well as whether it's trustworthy. And, one that's not so common in other countries, but getting approval to use and reference the evidence. In addition to that, what sometimes we find that there's a dearth of or outdated primary research studies to help us in problem framing and determine equity considerations or the feasibility of implementing an intervention locally or assist with finding barriers and counter strategies. And this at times led us to focus or shift to unconventional source materials. Next slide. So some example of unconventional source materials we would have used in the past is, fortunately for us, most of our national policies have a background section or local context section or context and rationale section that would have a lot of description inside there. So we've used that in the past. We key informant interview reports and transcripts. We also fortunately have a guide to social programs and services that provide program descriptions. So we've used that in the past. We've used national reports and development strategies, as well as social mitigation plan, recovery roadmaps, social investment plans, and public service commission reports. Next slide. So it's always great to have a new tool, as it's always great to have a new gadget at home. We're excited to learn about the ACE tool. We have previously used the SAT tool or system, that is source accuracy, relevance, and timeliness. But in reviewing the ACE, what we found is that there was great alignment given the types of unconventional materials that we use or that we've used in the past. We also find that in a quick review, it's simple and easy to use. And I think we're extremely excited to pilot it in our context and possibly include it in our training material. So I'd just like to by saying, in resource constrained settings, such as developing countries or low and middle income countries, where at times we have limited empirical data, it's really critical for us to assess the strengths and weaknesses of unconventional source material, especially when they're going into to weighing the selection and the implementation of policy and programmatic interventions. So again, I thank you for being here. I thank you for sharing the tool, and most certainly we're excited to pilot it in the Caribbean. Thanks a lot, Etienne.
Thank you so much, Shelley and Avi, for sharing your perspectives at this point. And I wanted to initiate now, I think is a good time, to some Q&A. And please feel free to type your questions into Q&A. And I know my colleague Simon has been fantastic responding to the questions, but this is also a chance to ignite new questions as you respond and as you reflect on things. So Simon, I would like to give the floor to you to elaborate a little bit more on what we mean by unconventional evidence and why we call it unconventional evidence, because 10 years down the line, we might not call this unconventional evidence. Actually, this could become part of the mainstream evidence base that we are using for our work. So if you can elaborate on that, and I know there were some questions about examples using unconventional evidence and also some methodologies that are used. So if you don't mind elaborating on it as to start us off, please. Thank you.
Thanks, Özgen. As some people will recall, we had a lot of debates around what to call this group of sources. because it includes several different streams, if you like. We've got program reports and policy descriptions, forms of tacit knowledge or experiential knowledge, and other kind of materials that may be generated, indeed, as one of the Q&A participants mentioned, through participatory approaches with communities and so on, but that are not the product of an empirical research process. And so it was quite a struggle to come up with a good term. We landed on sources because we wanted to indicate that this is not material that's emerging from a systematic research process necessarily, but other types of sources. And sources seemed like a good term to encompass the heterogeneity of this material. And they're unconventional in the sense that they're not conventionally drawn into many policy processes and decision-making structures at the moment. And indeed, I'm sure that people who wouldn't really consider these sources to be evidence. But from our own experience, and as we've heard already from our colleagues, Shelley and Abby, can play a valuable role in many different aspects of the evidence ecosystem cycle. So that's a little bit of background on why we landed on that term, unconventional evidence sources. People are probably calling these sources many different things in different settings.
And Simon, while you were speaking, there was another question that came up about the tool. So I just want to ask that if the criteria are weighted, for example, that local contextual evidence can be of very high value and that this criteria would merit a higher weighted value.
Yeah, we haven't weighted the criteria or sort of assigned sort of numeric value to the different criteria that are in the tool. What we have done is to try and differentiate between criteria that can be applied to any source and those that should be applied to a source that shows some sort of collection or interpretation of empirical data. So that we have differentiated. I think, as those of you who've looked at the paper will see, that in making an overall assessment of the level of concerns that one has, that is a judgment looking across all of the criteria. And I think if in that judgment you felt that information related to a particular criterion was very important, you could certainly take that into account in the judgment and then provide an explanation. So there is scope to do that, but we haven't weighted. Back to you.
Thank you so much, Simon. So there are a couple of questions I see both in the chat and also in the Q&A, but I would like to turn to Abby and Shelley for their reflections. I think because you mentioned that you are doing this at the country level as well, and then Simon, please feel free to jump in with your reflections as well. Is there any best practice guidance available for how to search for those types of evidence? So when you're thinking about the work that you're doing at the country level that you described briefly, could you elaborate a little bit more about how you actually look for this kind of implementation guidance and sources, and moving into the future as well with the concept of ACE tool now? If you can elaborate a little bit on that. Any one of you can just jump in.
So for us, we tend to look at the website. So after we've conducted our stakeholder, we identify relevant partners or stakeholders, we tend to look at their websites and their repositories, and we get a lot of documents there. In addition to that, we conduct key informant interviews when doing evidence syntheses. And we usually have a last question that asks, do you have any sources of evidence that we can use? And they usually direct us to a lot of unconventional source material that is quite useful. Maybe I can just give Abby a few minutes to share his experience.
Thank you very much, Shelley.
Yeah, thank you, Shelley. I think there is no standard tool as such to systematically evaluate this category of knowledge. I'm hesitating to call it unconventional now. But they fall under grey literature, which has a broader denominator. Like grey literature could be anything, including the empirical studies, which do not find their way to peer-reviewed journal. So I think having some standard appraisal criteria and tool, which can be adapted actually at country level, would be a good guidance. So we are using our own judgment to select knowledge that falls in this category.
Thank you very much, Avi. And as you're speaking, I'm also thinking of this kind of gray literature searches are so painful and so hard. And so how can we use the technology of AI also to be able to help us as we are moving forward? I will give Simon a chance also to reflect on this. And also, Simon, there's a question that came up in the webinar chat that I thought you might like to tackle as well. Can we combine conventional and unconventional evidence in a research? How do we synthesize these evidence bases or sources and address the heterogeneity? So if you have any reflections on that as well, over to you.
Yeah, and in terms of searching for these sources, I'm sure there are people on the call who have more experience in that than I do. But when we've done it for evidence syntheses, it's largely been a process of developing the content area part of the search as you would for any search, if it's for a digital intervention or a clinical intervention or whatever it might be, the topic of interest. And then we've just not used the typical filters that we would, if we were looking for randomized trials or qualitative evidence, but rather run the search without those. Now, what one can also do after you've done that, if you're using a platform like EpiReview or Covidence and so on, is to then apply some of these filtering tools in reverse to remove randomized trials, primary qualitative studies, systematic reviews, and so on. And then what you have left is an assorted group of materials where hopefully your unconventional sources are also included, but it's going to be a sifting process. I know there, when you go down to the national level, there are, many other ways of doing it, utilizing platforms that have been established of national policy documents and so on. So Jinwei asked about, can we combine conventional and unconventional evidence in research? I mean, I think decision makers are doing this all the time because they're always bringing together a range of different information. Some of it may be research-based. Is this intervention effective? Is it likely to be cost-effective in my setting? And then they may also be drawing on the knowledge of program planners in their setting about acceptability issues, or looking to other settings to try and understand what affected implementation. So I think people are doing this all the time, and what we're trying to really do is provide some support for that process. And in a sense, it's about bringing some of those that information that's being used, perhaps, if you like, in a less explicit way, more explicitly into the decision-making process, or whatever the process is where it's being used. And indeed, as I mentioned in the chat, we've done this in WHO guidelines, where we've drawn on unconventional sources and evidence syntheses in order to help us better understand acceptability and feasibility issues. Back to you.
Well, Simon, I have noted 2 questions for you, and I think that's the last ones that we will be asking before, if there are no other questions. One is the anecdotal evidence versus unconventional. In terms of the terminology, I see that the question about that, if you can elaborate on that. And all the tools that are developed, with the rigorous way that you described, what is next for ACE tool? So where does it go from here?
Yes, I mean, I think perhaps, some people would describe some of the sources that we've alluded to as anecdotal, but I think there's a negative connotation to that. It's often a term used sort of in contrast to empirical research. And I think what we're trying to emphasize here is materials that help to bring the experiences and voices of people into a decision-making process, but in a more systematized way. So I think, the term of anecdotal is perhaps unhelpful, although, I accept that, some of the elements that we're talking about might be referred to in that way by people. Yeah, so what's next for ACE? I think for us, the key aspect is to get it out there and used. We really welcome feedback on ways it can be improved, but we need to sort of see it used more before we can get a sense of where the gaps are, where we need better guidance, and so on. I think either Annie or Oscar also referred to the program reporting standards, and we see a link between the ACE tool and program reporting and the quality of that. And I don't know, Oscar or Annie, if you want to talk a little bit to that, because I think that's another aspect that will hopefully develop in the future. Back to you.
Great. I will ask Annie if she would like to make some remarks on that.
I was playing with the questions and got lost in my mute. Yeah, happy to do so. And thanks, Simon, for bringing that up. And as I had said in the beginning, this really came out of, a collaborative effort. And again, all of us working in implementation research and trying to do these discussions and realizing that without knowing more about programs, we had a lot of blanks when we were discussing evidence, and Shelley and Abby both mentioned context, and some of the interventions really, you can't assess whether they're effective or not without understanding some of the mechanisms of implementation and how they were implemented and the quality of implementation. So when we started to look for that kind of information, again, really hard to find, very rarely available, particularly in effectiveness studies, but also not in the literature. So you have to know a program and be able to trace the program, and then people pull it together from different reports to donors or different reports, meeting reports and things like that. So we thought if we could find a way of having that a little more systematized, what were some of the core knowledge that people needed about implementation. And we tried to do a very systematic process to develop that program reporting standards. It was based on literature review, then Delphi, and then an expert meeting, and then actually testing it out with several projects, having them try to fill it out and report. Yeah, and so, we're hoping that, again, it serves for multiple purposes. And you'll see in the link we put up, we actually also, just like Simon's mentioning about ACE, really feel it's a tool. We've seen it adapted. One colleague used it for organizing a collection in a journal because it helped the writers organize what were some core content from each of the different programs they were showing. And other colleagues have used it to organize proposal writing because it helped them to also focus on what were some of the core information they should include in proposal, because they'll need to follow up with that information afterwards. So it's interesting how a general tool like that really has many purposes, but I encourage you to look at the link. There's a feedback tool there, and always happy to keep hoping for iterations of that. As people use this, use ACE tool as they use the program reporting standard, we think we'll improve it with different rounds, and feedback from users. So yeah, thanks for asking.
Thank you so much, Annie. And I have one question for Avi and Shelley, and if you can elaborate on this, asking about, just let me see, if you would like to elaborate on how you can use this tool and effort into the context of power shifting, decolonization, and localization, given potential to increase the use and uptake of local knowledge. If you could share your reflections with us. Any one of you, please. Maybe this time, Abby, you start, and then Shelley.
Yeah, thank you. That is a big question. So I think in a way this tool or process we would allow use of local evidence for decision making. So that would contribute to empowering local health system leaders and communities to use the knowledge which otherwise is excluded from peer-reviewed published journals. So I think in that way it could improve the balance between the north-south, if you will, or this unhealthy partnership we see in some of the decision generation, the evidence generation and decision making. Yeah, and I think the more and more we use such evidence, it would also contribute to its better documentation, as people would see value in it. So in that way, it can also increase the evidence base, whatever we call it, conventional, unconventional, or generally, that would also contribute to the narrowing of this gap. Thank you.
Thank you very much. Shelley, and over to you.
Sure, no problem. And I really just want to echo what Abby said, but I would also like to add that, it's also spotlight on the local contextualized evidence. Generally the empirical evidence gets all the attention, but it's put the spotlight on the local contextualized evidence, given a platform for local voices to be seen. What I want to echo that Abby said is that, once people know that the information is going to be used, how it's documented, how it's presented, and where it's stored hopefully would be improved over time.
Thank you so much. I just want to thank again to all the participants of this webinar for their insightful questions. You always wonder, will there be questions? And there's always more than you think there will be. So thank you so much. And thanks to the panelists for answering very thoughtfully as well. Annie.
Okay, now we're going to hear some words of wisdom from Professor John Reeder, who's the director of TDR, the Special Program for Research and Training in Tropical Diseases, since February 2012, and he's also the director of research for Health Department. So over to you, John.
Thanks, Annie, and hello to everybody on the webinar. Well, access and delivery issues are obviously really a fundamental part of universal healthcare, and without considering end users in this process, interventions are never going to reach their potential for health impact. One of the solutions for this is to embed implementation research as part of any intervention program. And as you know, this is research within real life health systems and community settings, away from the controlled settings associated with other kinds of research, and really targeted on solving problems on the ground and supporting scale up. TDR has made the building of capacity for this one of its main activities in recent years. However, as we've just heard from Abby and Shelley, while this is important, it's really not the full story of evidence generation. In WHO and in the science division in particular, we're thinking hard about how to improve the methodologies for research and norms and standards, and tools like the ACE tool will be really useful in moving this forward. So we heard from OSGE. WHO is known for developing global guidelines and recommendations for national policy development. But of course, this story doesn't stop there. We've really got to work then with partners to support the implementation of these evidence-based practices. And we're keenly aware that it's a not one-directional process. Experiences and difficulties in implementation should also feed back into policy and norms development. As countries look to answer the how as well as the what, and tackle complex health systems interventions, documented experiences will have a really important place in evidence-based decision-making processes. The challenge is to accomplish this with the level of confidence that goes into the guideline process, and the ACE tool can really help with this. Decision makers have a wide range of questions and information needs, and they want to draw on a wide range of sources, including documented experiences from their setting, when they're making these decisions. This unconventional evidence can complement other key sources, such as the synthesis of best available evidence and economic modeling. It's part of an array of evidence that we need to consider both at a global and national level. A key challenge here, though, is how to bring these sources together appropriately in ways that enable evidence-informed decision-making, and more work is needed on tools for this. WHO wants to ensure stakeholder views are part of the decision-making process. Unconventional sources can provide information on the views and experiences of people implementing or affected by a program or intervention, and wider use of these can help highlight perspectives that are sometimes marginalized in the decision-making process. ACE is a lever in the process of broadening the range of perspective-informed decision-making. While we've heard of excellent progress today, I think we'd all admit ACE is still a work in progress. Some gaps have been identified, and more experiences application will help refine it. WHO will be taking the next steps to integrate the ACE tool into our own processes, including orientation with staff in the use and potential applications, and hopefully seeing it further contribute to the development of this tool. So I'd just like to finish by congratulating both the WHO team, its partners, and all of the collaborators for this really exciting and important development. And I guess, to be corny, I'd say you'd really aced it.
Thank you very much, John. That comforts the selection of the ACE tool, and God knows we spent some time thinking about that acronym. So thank you for that, another usage. So really excellent webinar. Thank you so much, everyone, for being present. A few take-home messages. We heard from not only the tool itself and the utility of the tool, but how it can be applied to advance evidence-informed decision-making, obviously useful for norm-setting institutions like WHO, but also all actors grappling with health system strengthening and implementation at country level. We are entering an era of the SDG whereby we do require a strong focus on implementation and scale up of effective, affordable, acceptable, feasible interventions. I think we all know that, but we see this tool as one of a really strong approach to the toolkit that we have to advance evidence-informed implementation. So we also want to hear from you in terms of how you perceive this tool, how you can use it, and some of your own experiences in using the ACE tool. We encourage you to use it in your own work around evidence syntheses, evidence-informed policy and decision-making, and then share that experiential learning, share those experiences with us. There are numerous ways of engaging with the ACE group through the paper and through the contacts that are shared today with the webinar. So we look forward to hearing from you. I'd like us to also think about the counterfactual of not having a tool like that. And I think it speaks to the issue of lack of contextualization of certain programs and interventions. So this is how we're also seeing this tool, is to really foster the contextualization of policies, programs, and really supporting implementation, moving towards people-centered interventions and systems. And so we'd like to hear from real-world experiences in that space as well, how you're using it to support implementation and scale up. And I think Abby was was hitting the nail on the head by talking about issues around decolonizing global health. And so I think this is part of our toolbox to move in that direction, to make sure that we use community voices, we use local evidence and contextualized knowledge to support local action. So brings me also to the last point around capacity strengthening. We do have a vision to develop a capacity strengthening initiative around the ACE tool to advance the tool itself. It is a living tool, so we want to hear from you in terms of adaptation. I truly agree with Annie on that, but then also how we can improve it in the next iterations and how you are applying it. So we are thinking already of additional opportunities opportunities for capacity strengthening to support the uptake of the ACE tool in different contexts. So if you have ideas for us in terms of thinking around capacity strengthening efforts, we're also all ears, and we welcome your bright ideas. And so I'll finish here. We're on top of the hour, which is very surprising considering the amount of panels that the panelists that we had today. But I do want to thank you for a very engaging webinar, all the questions in the chat and the Q&A. We will share a recording of this webinar and the information that we were able to answer also in the Q&A and the chat. And so thank you everyone once again, and we will love to hear from you in terms of your experience using the ACE tool. And please watch that space, more to follow. Thank you very much.